Welcome to this edition of the First Aid Show. Asthma can be fatal, and as a first aider you need to quickly identify the patient is having an asthma attack. In this film we asked a paramedic to explain about asthma and its treatment.
When somebody is having an asthma attack, we should never underplay it because people can die of an asthma attack. So it's really important that we get treatment to them quickly. There are a number of steps that the first person that's with them, the first person on scene, can take to help look after that person and minimise the severity of the asthma attack. So basically what's happening is the airways are narrowed, maybe because of an infection or a cold, or they're in a spasm, and there can be a number of factors that have caused this to happen. You really need to make sure that that person has taken their own asthma pump. Most asthmatics have inhalers if they know that they've got asthma. Generally there are two types of inhalers. There's a preventer and a reliever. If they're having an acute asthma attack, you want to give them the reliever that opens up the airway. This can sometimes be blue in colour, but not always the case. The person will know which is the inhaler that they need to take. Encourage the patient to keep taking their inhaler as many times as they need to try and give them some relief. You would need to make sure the patient is calm, in a warm environment, sitting upright, and if necessary, they can lean forward to optimise their ability to breathe. Stay with them, keep them nice and calm, and be really reassuring and softly spoken with your voice. When you cannot breathe, it is extremely frightening, and people do tend to start to feel anxious, which does not help the situation. You absolutely do need to call us to come and help. If the patient is still able to talk and explain to you their situation, or any relatives or friends that know about their asthma, it's really good to know, has this person ever had a nebulizer before? Has this person ever been hospitalised with their asthma attacks? Has this person been taking a course of steroids to treat their asthma? And has this person ever been admitted to intensive care? All of these things are really helpful to provide the ambulance service when we arrive on scene.